Thank you, ma'am. Thank you so much.
Thank you, Hindi team. And welcome to all. Good evening, and warm welcome, dear all. Today is we are starting the English session. So today is our 2084th day of uninterrupted daily webinar of IFPH. So we are welcoming you all, dear doctors and all the students. So today our guest is Dr. HUANG WEI LING. So let us see who she is. Dr. Ling, born in Taiwan, raised and graduated in medicine in Brazil, specialist in infectious and parasitic diseases, a general practitioner, parenteral and enteral medical nutrition therapist, acupuncture, pain management, and homeopathy. Since 1997, she works with the approach and treatment of all chronic diseases in a holistic way, with treatment guided through the teachings of traditional and Chinese medicine and Hippocrates, author of the theory of constitutional homeopathy of the 5 elements based on traditional Chinese medicine, author of more than 230 publications about treatment of variety of diseases, rebalancing the internal energy. So, wow, how great, ma'am. So, and our today's subject is mechanism of action of homeopathy. So, let us welcome Dr. Wei Ling Huang to this wonderful platform. So, ma'am, the dice is yours. Now you can start. Today, my name is I am Dr. Sheila Prem, today's moderator. So, once again, I am welcoming you all.
Okay, thank you for introducing me. I will share my data show, okay?
Yes.
Can you see my data show?
Yes.
Yes?
Yes.
I don't know how to put for the entire video. Can it stay like this?
We can now see the screen mechanism of action of homeopathy, the front page, I think.
Okay. Good morning to everyone. My name is HUANG WEI LING. This is an important session that I prepared to all homeopathy doctors all over the world because I am new in homeopathy. Homeopathy was my last specialty here in Brazil. And when I began to study homeopathy, I had 20 years of studying and using traditional Chinese medicine in my clinical practice in Brazil. And that is why when I began to study homeopathy, I realized that homeopathy works like Chinese medicine reasoning. And that is why today I will show to you how is the mechanism of this action, because when I begin to study, I saw the medication that what they can treat, and I can see the mechanism of each medication without using all the process that usually the homeopathy doctors are using. And that is why I want to share with you today this kind of a reasoning. Oh, I don't know how to go ahead. According to Albert Einstein, he said that we cannot solve our problems with the same thinking we use to create them. And that's why this is what I want to share with you, because when we use homeopathy, I feel that the majority of doctors are using the Hahnemann way of thinking, using the Similiman theory, but there is another things that we need to know in this action. This is the Samuel Hahnemann, the creator of homeopathy, and homeopathy today is considered the first medication to be prescribed for the whole population globally. In my studies in Brazil, because we changed the energy pattern of the human body, since 12 years ago in this new global immune deficiency caused by the modernization of telecommunication. And what I am basing this talk is based in this book that say that homeopathy and acupuncture works similar using the bioenergy presented in the human body. Nowadays, what we are treating is like an iceberg, but what we can see is only the tip of the iceberg. And when Hahnemann said that homeopathy works with the vital energy is not, we cannot see the vital energy. The vital energy is invisible to our naked eye, but is in this part of the iceberg that we need to understand what is the meaning of this vital energy in this part of the iceberg. And this is the aim of this presentation today. And also, I usually use the metaphor of the tree to show the different viewpoints between Western homeopathy and traditional Chinese medicine. This tree is symbolizing the human body and is divided in the part above the earth and the part under the earth. And also, we can see that this tree also is suffering the influence of the external pathogenic factors such as cold, wind, heat, humidity, and dryness that can induce the formation of sun disease in the human being. This is very important to us to understand because when we see the mechanism of action of each medication, we need to understand how is the formation of the disease in this leaf level, but we need to understand that the human being is also has this part that is visible, the part that we cannot see, that is the energy part, the part of the vital energy that Hahnemann is saying that is under the earth. And this is the main part that I will say in this presentation. And when we see a tree, the tree is here, the symptoms are here, we can see. But the majority symptoms come from the influence of these external pathogenic factors or the influence of these alterations of energy presented in the root that could be years of energy alterations before transform it in the materialized disease in the leaf level of this tree. And what I want to transmit today in this presentation is that each symptom presented here, usually Western homeopathy doctors are translated in the allopathic symptoms, such as fever, sore throat, pneumonia, convulsion, but what we need to understand is that this symptom is caused by these alterations here. And that's why we need to understand that each symptom has some alteration in this root, in the vital energy called by Samuel Hahnemann, but he didn't explain exactly what is happening in this vital energy, in this root, and this is the aim of this presentation. So when somebody has some symptoms presented in this leaf level, we need to understand that there are some alterations here in this root that is causing this symptom. So in traditional Chinese, why I'm saying in this presentation about traditional Chinese medicine, because homeopathy, in my point of view, and according to the book I mentioned previously, They are saying that homeopathy works like acupuncture and Chinese medicine. And that's why I need to introduce to you what is the theory in traditional Chinese medicine to you to understand what I want to say today. So according to TCM, there are 12 principal meridians in the body. In meridians is in the ventral part of the body, and young energy meridians that all homeopathy medications are working in these meridians. So there are 6 in meridians, lung, heart, spleen, kidney, and liver, and 6 young meridians in this part, that's large intestine and small intestine, stomach, bladder, and gallbladder. And for each internal massive organ in Chinese medicine, there is a hollow organ that's accouplated to it. For example, liver and gallbladder are one couple, heart and small intestine is another couple, spleen and stomach, lung and large intestine, kidney and bladder, and pericardium and sanjiao. So we need to understand this flow. How is this vital energy flow inside the body? That we need to know, because when some patient in front of you are saying that he usually wakes up at 3 in the morning, you need to understand what's this meaning. So the flow of energy in these 25 hours in these 12 meridians is according to this cycle. In the 3 in the morning is the lung energy meridian and goes to the large intestine in the 5 and 7 a.m. And at 7 to 9 a.m. is the stomach meridian to go to the spleen, that's 9 to 11 a.m. And after is the heart energy going to small intestine, that many patients with heart disease had heart attack at this time, is the heart period between 11 and 1 p.m. to small intestine. And after there is the bladder and kidney energy that it's about the 6 p.m. And we usually see patients that saying that they usually have fatigue at this time. This means the energy of the kidney of this patient is quite empty, and you need to work with the kidney energy. And after this is the pericardium and triple, it's another energy. And after is the gallbladder and liver, that usually patients that has insomnia in this period, they sleep and wakes up at 1 or 2 a.m. in the morning and cannot sleep. And you need to understand that this is this gallbladder and liver energy that's working, and that you need to balance this energy to treat your patient. And what homeopathy medication are working at this time? At the lung meridian, you can use kali carbonicum. After 5 to 7 a.m., you can use nux vomica. When the patient has this symptom that they are saying, oh, I am having stomach pain, or at this time, you can use sulfur. And when some of your patients are having symptoms at between 9 and 11, you can use sepia natrium muriaticum. And to treat heart, you can use Spigelia argentum. And between 1 and 3 a.m. small testing, you can use belladonna. And between 3 and 5, you can use apis and silicia and sulfur. And between 5 and 7, you need to treat the kidney. You can use lycopodium. And between 7 and 9, you can use Hustox and Bovista. And between 9 and 11, you use Brionia and Humex. And between 11 and 1 a.m., you can use aconitum or phosphorus. And between 1 and 3 a.m., it's the liver time. You can use arsenicum album. The difference of there are two syndromes in traditional Chinese medicine is the superficial syndrome and the deep syndrome. The superficial syndrome is usually caused by the invasion of wind and cold inside the human body, leading to the clinical manifestation of chills, a fever, body aches, sneezing, sore throat. And when the patient has this symptom, you need to understand that this is caused by the invasion of wind and cold, and then you need to expel this wind and cold from the body of the patient using aconitum, belladonna, or epar-sulfur. You use aconitum is the main medication to release the cold that the patient was submitted by these external pathogenic factors. And belladonna and epar-sulfur is when the patient has purulent secretion or in the upper respiratory tract infection, because this cold is entering inside the human being and is transforming in the heat, and that is why it's have a purulent or yellow secretion because of this transformation. You need to understand all these mechanisms to understand what is happening in each phase of the formation of disease. And the second theory in the Chinese medicine is the yin yang theory, is symbolized by this symbol. And all the treatment in Chinese medicine aims to balance these two energies. And also, I think you need to understand that when there is an imbalance of these two energies, there is a formation of symptoms in the leaf level of the tree. So yin and yang, there is yin and yang energies in all the universe. Yang is composed by sun, heat, movement, function, excess, and yin is symbolized by moon, cold, rest, inward, downward, substance, and deficiencies. And that is why male and female, cold and hot, and summer and winter. And this is what the patient is saying to you. You need to ask him what he feels. If he feels more cold or hot, or cold and hot, or if he have abnormal sweating during the day, or he have some constipation, do have daily bowel movement, because all these is signs and symptoms that there are energy alterations in the root of this tree that you need to treat. For example, if the patient has hot flashes, like a woman in menopause, this means the patient has energy deficiency. And the homeopathy medication that you can use in this case is lacasia or sulfur. When the patient has cold hand and cold feet and do not have hot sensation, you can use arsenicum album. But there are patients that can feel cold and hot. This means that the patient has yin energy and yang energy deficiency, both deficiencies. And in this situation, you can use mercurial solubilis and carbo vegetabilis. When the patient have abnormal sweating during the day, this means that he has qi deficiency or qi prana deficiency. And in this situation, you can use it, China. And when the patient he don't have a daily bowel movement, this means that he has blood energy deficiency. And in this case, you can use alumina, I don't know here, another medication. And this is the main energy flow inside the human body that we need to understand. This is the main thing that we need to balance in the human body, the yin yang, qi, and blood inside the human body. And this is why in all my patients, I usually ask the signs and symptoms of deficiency of all these four energies. If he had hot flashes, cold hand and cold feet, abnormal sweating during the day, or not having daily bowel movement. Because if the patient has some energy deficiencies of these four energies, inside the body, there is a formation of internal fire inside the body. That is, internal fire is, you can see that the patient is have dry mouth, bad breath, abdominal pain, pruritus, skin redness, purulent discharge, microhematuria, irritability, anxiety, panic syndrome. And all these signs and symptoms is clinical manifestation of that the patient is forming this heat retention in the root of this tree, that you need to treat this condition using mercury solubilis, bryonia, creosotum, sulfur, mesareum, or silicia. Oh, it's not going. Yeah. The second theory in the root of this tree is the 5-element theory. The 5 elements exist in all the universe and all inside the human body. This element corresponds to water, wood, fire, earth, and metal. And as you can see, each element is sending energy to the other element. And each element corresponds to one internal massive organ in traditional Chinese medicine, such as water corresponds to kidney, wood to liver, fire to heart, earth corresponds to spleen, and metal to lung. And each internal mass organ is responsible for the production of one internal energy or one internal vital energy called by Samuel Hahnemann or pranas, studied by Ayurvedic medicine. So kidney is responsible for bone, for hearing process, for our teeth, for our bone, sexual functions, and reproduction. Wood is responsible for our vision, for restoring blood inside the body, and also to distribute the vital energy throughout the body. And the heart is responsible for our communication and all the sleeping process. And nowadays we are having so many patients suffering from insomnia, and the majority of cases caused by this lack of energy, of this fire energy of the heart that we need to treat. And the earth is responsible for the absorption of nutrients and the formation of blood. And that's why nowadays also the people are not having earth energy. And that's why the majority of nutrients that the majority of people are eating is not absorbing adequately to form the energy, internal energy or prana, leading to the worsening of our energy. And the metal is responsible for the sense of smell, and also for distribute all these prana or this energy throughout the body. And as you can see, one element is controlling other energy. This is the control cycle and generation cycle. Each internal massive organ has one emotion that they are responsible. For example, the liver can be imbalanced by the anger. And when the patient is saying to you that he usually has anger, you need to understand that this anger could come from the liver energy alterations. And the excessive joy can imbalance the heart energy meridian. When the patient is having excessive worry, you can understand that this worry can influence the spleen energy function. And excessive of sadness or grief can imbalance the lung energy, and excessive fear could be the kidney energy alterations. And fear also could be caused by alteration in the gallbladder energy can also lead to fear sensations. And according to the flavor that the patient has wanted to eat, when the patient wanted to eat more sweet taste, for example, he is having the spleen energy alterations, and you need to use mercury solubilis or all these remedies that you can use. When the patient like to eat more vinegar-like taste, you can use pulsatilla and lycopodium. And when the patient want to eat more bitter taste, you can use Nux vomica, bryonica, or chamomilla. And when the patient has want to eat more spicy, it's because his lung energy is could be deficient, and you can use allium cepa and sanguinaria. And when the patient want to eat more salty or have metallic taste, you can use natrium muriatic or mercurius. And according to traditional Chinese medicine, all these organs, these 5 organs, you can divide them into alterations in yin energy deficiency or yang energy deficiency or qi deficiency. And this is what I want to show to you, that if the patient of these 5 elements has yin energy deficiency, he have in the lung dry cough, scanty stick sputum, dryness in the nose and throat. When the patient has yin energy deficiency in the heart, they can have insomnia, palpitation, anxiety, night sweats. And when the patient has spleen energy deficiency, dry lips, poor appetite. And when the patient has liver energy deficiency, he could have dry eyes, blurred vision, dizziness, tinnitus. This is very common nowadays. People have dizziness and tinnitus. You need to understand that this is caused by liver alterations, irritability. And when the patient has energy of the kidney is the patient can present lumbar and knee pain, night sweats, tinnitus, low-grade fever, flush, and hair loss. And in the case that the patient has yang energy deficiency of all these 5 organs, they can present shortness of breath, weak voice, spontaneous sweat and slight effort, cold sensation in the chest, cough with clear watery mucus. In the case of yang energy deficiency of the heart, the patient can present cold extremities, chest stiffness, severe chest pain, deep weak pulse, palpitation. And in the case of spleen energy, yang energy deficiency, the patient have chronic loose stool and poor appetite, abdominal distension. And yang energy deficiency of the liver, the patient have dizziness, cold limbs alternating with the heat of the head, and the young energy deficiency of the kidney. The patient can have cold lumbar region. The patient, my lumbar is cold, and weak knees, nocturnal urination, low libido, and lower body edema, and the feet always is cold. In the case of the patient is suffering from Qi energy deficiency of one of these organs, in the case of lung, he can have breathlessness, low voice, pale complexion, spontaneous sweating, frequent colds, and cold aversion. In the case of Qi deficiency of the heart, they can have palpitation, restlessness, distension in the chest, sweating on exertion, arrhythmia, and pale tongue. Qi deficiency in the spleen, he can have poor appetite, abdominal distension, diarrhea, tiredness. Qi deficiency of the liver, he can present mild depression and emotional lability, weak vision, easy fatigue, sense of stagnation under ribs. And Qi deficiency of the kidney, the patient could have weak constitution, development delay, asthma, like dyspnea, enuresis, edema, weakness in the lower and back legs. So, to understand which medication you can use in all these signs and symptoms, you need to investigate in the anamnesis what is happening in the root of these three. If he is feeling cold, hot, or both, this means indeficiency or yin yang energy deficiency or only yang energy deficiency. If the patient is sweating abnormally during the day, this means that he has Qi energy deficiency. And when the patient has abnormal, not daily bowel movement, this means that he has blood deficiency. And when the patient has dry mouth, bad breath, skin redness, and the microhematuria and bad breath, this means that he is having internal fire that I showed to you previously, which homeopathy medication we can use in all these case. Nowadays, we are studying the symptoms in the leaf level of the tree, but each symptom presented by each patient, you can understand that in which organ and which energy alteration is happening in this root that is causing the symptoms in the leaf level. So this is very important to us to understand because we need to begin to write more articles. We need to prove to the world that homeopathy works. But to you to write an article, you need to write how is the mechanism of action of that medication that you are using to treat this patient. And that's why it's very important to you to understand that this medication to treat this symptom is coming here in this root, in this mechanism, treating the kidney or liver or the heart or the spleen, or treating the external pathogenic factors, or treating both the external pathogenic factors and also the root. So I'm finishing my presentation because I created this Wu Wei methodology beginning to treat the root and not just the symptoms. Because if we understand which is the meaning of each symptoms presented by each patient, we can treat the root and also the leaf level combining the two theories. Because nowadays we are facing the new global immunodeficiency, and this immunodeficiency was discovered by myself here in Brazil in 2014, when I began to measure the energy of the majority of my patients in 2010 using the radiesthesia procedure. And at that time, 2010, the majority of patients were normal, quite normal. But in 2014, I discovered that the majority of patients, including babies, children, adolescents, young adults, and older patients, independent on the age group and independent on the type of diagnosis, they were presenting energy deficiency in all these 5 internal massive organs. And at that time, I was beginning to study homeopathy. I began to study homeopathy at this time. And after my course, I wrote a new theory called the constitutional homeopathy of the 5 elements based on traditional Chinese medicine. Because instead of treating the leaf level, I am treating in the deepest level of the human body, in the energy part, treating the root. I am not saying that the homeopathy that other homeopathy medication cannot treat, they can treat. But this is very important to understand that the homeopathy medication that you are using to treat the symptom are treating the root by each of these mechanisms. And the doctors need to understand all these mechanisms to know which is the energy alteration called vital energy by Samuel Hahnemann that is altered in this patient that you need to treat and to know which medication that you need to use in each case. So I created this HUANG WEI Medical Club to treat the medical doctors nowadays, to begin to treat the root also, because the majority of patients worldwide in any kind of country, they are having this energy deficiency in the root. And that's why I'm not saying that you need only to treat the root. We need to combine nowadays the treatment of the root with the treatment of the symptoms. Also the symptom, using homeopathy medication to treat the root, and also some emotional symptoms. And this is only the pre-launch of my first book that I will begin to sell here in Brazil and all the worldwide, about the formation of cancer. Because cancer patients are treated in Western medicine, in modern medicine, they are only treating the leaf level of this tree. But in this book, I'm showing many cases of patients that were suffering from cancer, and the necessity of us to treat the root, to treat the cause. And that's why if you want to have this book, you can put your name here in this card, in this here, to us to know that you want to have this book to read. And it will have, we will begin to sell in 1 or 2 months, because we need to register this book and all these kind of things. According to Hippocrates, he is saying that whenever the art of medicine is love, there is also a love of humanity. And I want to finish my presentation. If you have some questions, I will be very happy to answer you. Thank you.
Yes, ma'am. It's really a wonderful session. Your yin yang theory, and it is resembling to our homeopathy actually. So you are also telling about the treating the leaves, that is superficially, and for us also, we are considering the miasmatic background. So going to the deep root, that means the underlying cause or miasmatic background is necessary for curing the case, each and every case. So otherwise, it is only a palliative effect only, right?
Yes.
Yes, ma'am. So it was a wonderful session. So if anyone have any questions, please ask, or you can message in the chat box, please. Dr. Dhanesh. So, ma'am, I have one question. This in Chinese medicine, only the which kingdom we are using? Only herbal kingdom, or other plants are only using for this Chinese medicine, or which type, ma'am?
Yeah, in China, they still using Chinese herbal therapy. But as I showed to you that we are facing this new global immune deficiency, the majority of patients nowadays are not having energy in the 5 internal massive organs that are the liver, the kidney, the heart, the spleen, and lungs. And for this reason, for this change in the type of energy of the population, we also need to change the way of treatment of this patient. And for this reason, according to Arnschult's law created in 1888 by 2 German researchers, they are saying that the use of any kind of high concentrated medication can reduce even more this vital energy that's already very low. For this reason, this could be cause many complications such as thrombosis, myocardial infarction, strokes, or sudden death. For this reason, I began this presentation saying that homeopathy, that is a highly diluted medication, is the medication of choice to be used in this new type of population that we are having nowadays, considered immune deficient caused by the modernization of telecommunication. And for this reason, homeopathy is the medication of choice. We need to be the number 1 in the world. And that is why we need to begin to write more articles, show the mechanism of action of homeopathy to the medical group, know that homeopathy can work and can be used in this new type of population that is not the same as in the past. In the past, we were different because the energy of the population were normal, was green, was not empty like today. Today, we are very weak in energy, and for this reason, we cannot use any kind of high concentrated medication. And for this reason, this Wu Wei methodology is to treat the doctors who wants to understand how can they treat the majority of patients nowadays that are considered immune deficient, using another kind of method to cure the patients nowadays without using the antibiotics, antidepressant medication, chemotherapy, and other kinds of therapy that is caused by these energy alterations presented in this route that we are not treating nowadays.
Okay, ma'am. Dr. Sridhar could raise the hand.
Yes,
Please, ma'am.
ma'am. Dr. Mel Ling, it was a very wonderful section. Thank you very
Thank
much.
you.
I like to ask 1 or 2 questions. One is that whether in Chinese medicine, if there is any importance for the food and exercise and the mental emotion level, how you deal such things, whether having any importance or not in Chinese medicine.
The emotional part.
Yeah.
Yeah, this is very important because I showed to you each emotion is related to the imbalance of each internal massive organs. For example, excessive fear is mean that the patient has kidney energy deficiency. Excessive worry can lead to alteration in the spleen. Excessive sadness can cause alteration in the lung. And that's why when the patient in front of you is saying that they are having some of these emotions, you can understand that the problem inside the patient is the alteration in these organs. An excessive how can I say? I forgot. An excessive anger can lead to alteration in the liver energy. An excessive anger in China is very common to lead to stroke because they usually have many anger in China, and this can lead to alteration in the liver energy, and this is one of the cause of the formation of the strokes in Chinese medicine.
And another question is that there is any Chinese medicine like that, of it is in homeopathy, ginseng, and so many other medicines from Chinese like that, of it is using. Is there is any medicine like that of improving the health in general, chronic like that, improving, extending the age and such things, preventing aging and etc. Some medicines are there.
I can't understand you. You're speaking so quickly.
I shall slowly to speak. Okay.
Okay.
If there is any medicine to extend the life and preventing the aging process and to be more healthy, some medicines are there. Or
Yeah, I show to you because as I told you, the majority of patients are very weak in energy, and this is leading to a state of new immune deficiency, but not caused by HIV or caused by the use of some medications such as corticosteroids or immunosuppressors. This is called caused by the influence of the use of cell phones and computers and Wi-Fi. And that's why I discovered this problem. And to prevent the formation of disease in this state of immune deficiency, we need to use 5 homeopathy medication that are sulfur, calcária carbônica, silícia, natrium muriaticum, and phosphorus. This is like a gasoline for our body to keep their working normally, to keep the organs to function, and to prevent the formation, the majority of disease, such as myocardial infarction and cancer. That is the main things that's happening in the whole world. The cancer is the main disease that is causing problems. And the majority of people are having sudden death caused by myocardial infarction, but this is caused by this energy alteration that the Western medicine, they do not know, still do not study this part because they consider the part of energy not scientific. And that's why they are not studying this, but they need to begin to study because this is the part that is affecting the formation of the human being nowadays, and we need to treat this part that is invisible to the naked eye, and it is not appearing in the laboratory exams. And the normal laboratory exams do not mean that the patient do not have anything. Nowadays, when the patient is having normal exam, this means that this is not normal. The part of energy is affected, and we need also to treat this energy before they can produce some disease in the future.
Thank you very much for your answer for my question. Thank you very much.
Okay,
Come again.
you're welcome. Bye-bye.
Okay.
Yes. Thank you, Dr. HUANG WEI LING. It's really a very good session. And as you point out here, the principle of working of homeopathy medicine is something different from what others. Most people believe that this is something like antibiotic or antiviral drug or something like that. But actually, homeopathy is an entirely different system. We used to say that any derangement in the vital force can be called as a disease. Then what is vital force? An invisible phenomenon behind one person. And that vital force need to be boosted to improve the quality and quality of life of each and every person. If the derangement happen in that particular vital force, as we all know that it is an invisible one, we cannot give something directly to the vital force. But how homeopathic medicine work is entirely different. And when you can choose the vital force of each and every person in a different way. My vital force is different from yours, and your vital force is different from Dr. Sheila. Of course, we are all having common organs except our sexual organ. Am I right? But
Yeah.
in those conditions, homeopathy a homeopath need to find the different identification, the personal difference between you and me and then Dr. Sheila, Dr. Sridhara Professor. And then only that is what we call as individualization. So you find the individualization, you can differentiate. You can choose a medicine as per the individuality of that particular person. And after choosing the individuality of course, for example, if I am a brilliant person, you can give very, very high potency medicine and that in a single dose. But if I am a dull person, I am very weak. If I am not able to respond to stimuli quickly, then I need a medicine that in a low potency and that too in frequent doses, so that then only the vital force can be stimulated and make into a better level. Then only the person get the benefit of the so-called medicine you administer to the person. That's how homeopathic medicine works. And there is people believe that the power of the medicine is the quantity of the medicine. No, in homeopathy, the quality of the medicine is something greater than the quantity of the medicine. That's the reason why when you give a medicine which is 100% right, but if the potency is in tandem with the requirement, it may not work as quickly as expected. Sometimes it may work, but you may get the result in a delayed way. That's what's your opinion on that, Doctor?
Yeah, I agree with you. All this is very true.
So here the energy level that you people are calling it in Chinese word, you are calling it as the energy, but in homeopathy it is not only the energy but something else. When a person loses his vital force, he is no more. He will be just like a cadaver.
Yeah.
So it is not the energy alone, but something else, something beyond that. Am I right?
Yes.
We are a little bit higher level in that respect in all to when compared to other systems of medicine. And that's what I would like to add to your presentation. Is there anyone?
Yeah, I will write one book about this mechanism, and I think we will have this book this year.
Even some people used to ask, "Oh, doctor, can I take these homeopathic pills because whether it produces diabetes if you take these pills in a regular day-to-day basis on a day-to-day basis?" But it is absolutely wrong. You can take homeopathic medicine. It will not make any diabetes, even though it is sugar pills. We are taking lot of things which are sweet in taste, but for example, rice, uh, tapioca, all these are same thing. All this comprises of glucose, but everything will not produce diabetes. If the person has some derangement in his vital force, you can get the disease. Otherwise, you
Yeah,
don't get the disease. That's
yeah,
what. Even though we used to say that it is uh, lifestyle diseases, but actually it is only specification for something like to that, but actually it is entirely different. Okay.
Okay, thank you, Danesh sir. So those who want to ask any questions, any more? Okay, so let us conclude, sir.
We can invite Dr. Amresh sir to say vote of thanks.
Okay. Dr. Ramparvesh sir. Please come, sir.
Please unmute.
Okay. Yes, sir.
Thank you, Dr. Daneji, Dr. Sheila, and congratulations, Dr. HUANG WEI LING. Very nice, excellent session. Mechanism of action of homeopathy. Homeopathy is the action of dynamic, action of vital force. And medicine, homeopathic medicine, action of vital force, not body. So there are three action, dynamic action, energy, dynamic energy action. Cause, dynamic. Cause of disease is dynamic, anger, sad, insulting, and mind. Cause of disease, mind is a dynamic. And homeopathic medicine is a dynamic, nanotechnology, nano energy. And action, vital for action is a dynamic. So there are three dynamic difference other pathy. So very, very thanks, Dr. HUANG WEI LING. Thank you. Again, presentation. Very, very thanks. Thank you.
you're welcome.
Thank you so much, ma'am. So, I think now it is time for the Malayalam session. I am handing over to Dr. Shaila. Thank you, ma'am.